Today we're talking about a tragic and disturbing case that has shocked the world, a case that has left an indelible mark on the healthcare community and beyond. The story of Lucy, a midwife who was responsible for the deaths of several infants under her care, a betrayal of trust that has left families devastated and searching for answers. This heartbreaking case raises difficult questions about trust, professional integrity, and the signs we should all be aware of to protect our loved ones as we navigate the complexities of healthcare. In this video, we'll delve into Lucy's motives, exploring the psychological and situational factors that may have driven her to commit such heinous acts, how she carried out her actions, examining the methods she used and the opportunities she exploited within the hospital environment, and most importantly, how to protect your baby and ensure the safety of those in your care by recognizing warning signs and advocating for transparency and accountability in healthcare settings. The setting is a place where trust is paramount, a hospital, where lives are saved and new ones begin, a sanctuary of healing that was tragically compromised. But within these walls, a sinister story unfolded, challenging our perceptions of safety and care, and reminding us of the importance of vigilance and the need for systemic change. Lucy Letby, a seemingly qualified and well-respected midwife, was known for her gentle demeanor and professionalism. She was trusted to care for newborns in the hospital, a responsibility she appeared to take very seriously. Born in Hereford, she graduated from Chester University with a nursing degree, where she excelled in her studies. Lucy had always been passionate about neonatal care, often volunteering for extra shifts and participating in training sessions. Her colleagues described her as dedicated and compassionate, always willing to lend a hand. However, what appeared to be a routine shift soon turned into something horrific. The story began with a series of unexplained infant deaths, which left the hospital staff in shock and confusion. Over time, the number of babies who died under Lucy's care began to rise, raising alarm bells among the medical community and prompting an internal review. But it wasn't until the authorities conducted a thorough investigation, involving multiple agencies and extensive forensic analysis, that they discovered the unimaginable truth. The findings were both shocking and heartbreaking, revealing a sinister pattern behind the tragic events. So how did Lucy carry out these horrific acts? The details are both chilling and complex. Lucy was a skilled medical professional, which made her even more dangerous. Her expertise allowed her to blend in seamlessly with her colleagues. She knew exactly what she was doing, how to evade suspicion, and how to manipulate medical tools and substances to carry out her crimes. Her actions were calculated and methodical. Through careful monitoring of the baby's conditions and administering lethal doses of substances such as sedatives or other poisons, Lucy killed the infants. She exploited the vulnerabilities of these fragile lives. This was done under the guise of medical necessity, making it difficult for anyone to spot the pattern until it was too late. Her actions were masked by the very protocols meant to protect patients. Lucy often used insulin and air embolisms to cause sudden and unexplained collapses in the infants. These methods were chosen for their ability to mimic natural medical emergencies. She would alter medical records to cover her tracks, making it appear as though the deaths were due to natural causes or unavoidable complications. This manipulation of records delayed any suspicion. By exploiting her position of trust, Lucy was able to carry out her deadly actions without immediate detection. Her trusted role provided the perfect cover for her heinous acts. Why would someone do something so monstrous? What drives a person to commit such heinous acts, especially in a profession dedicated to saving lives? The truth is, Lucy's motivations remain partially unclear. Despite extensive investigations and psychological evaluations, a definitive answer eludes us. Some believe it was a desire for attention, a need for control, or a way to gain sympathy from colleagues and superiors, or perhaps even a deep psychological issue that went undetected for years. Mental health professionals have speculated about various disorders that could explain her behavior. Some experts suggest she might have had Munchausen syndrome by proxy, where a caregiver fabricates or induces illness in those under their care. This rare condition often stems from a need for attention and validation. Others speculate she could have been driven by a need to feel powerful in a high-stress environment. The intense pressure and responsibility of neonatal care might have exacerbated underlying issues, Whatever her reason, the consequences were devastating. Families lost their children, and the emotional toll on the community was immeasurable, and the trust in the very healthcare system that was supposed to protect them was shattered. The case of Lucy Letby serves as a grim reminder of the vulnerabilities within our medical institutions. Lucy's case serves as a tragic reminder that not all healthcare professionals are trustworthy. While most are dedicated and compassionate, it's crucial to remain vigilant. But how can you, as a parent, ensure that your baby is safe when you're entrusting their care to others? Building a relationship with the healthcare team and staying informed about your baby's condition are key steps. There are signs to look for that may indicate something is wrong. Recognizing these signs early can make a significant difference in ensuring your baby's safety. Here's what you should keep an eye on when interacting with healthcare professionals. Awareness and proactive questioning can help you identify potential issues. Frequent changes in medical staff. If you notice that your baby is being attended to by different nurses or midwives regularly, without explanation, it could be a red flag. Consistency in care is important for monitoring your baby's progress. Unusual behavior or secrecy. A healthcare professional who seems overly secretive, defensive, or avoids answering questions about your baby's care could be hiding something. Transparency is crucial in healthcare settings. Over-medication or unexplained changes in treatment. Pay attention to any sudden, unnecessary changes in your baby's prescribed treatment or medications that don't seem to align with the diagnosis. Always ask for a clear rationale for any changes. Unusual signs of distress in the baby. If your baby suddenly shows signs of distress that can't be explained, ask for a second opinion or an investigation. Trust your instincts as a parent. Inconsistent medical records. Look for inconsistencies in your baby's medical records. If the records don't match what you've been told, it could be a sign of something suspicious. Accurate documentation is essential for proper care. Avoidance of eye contact. Healthcare workers who avoid eye contact or seem nervous when discussing your baby's condition might be hiding something. Confidence and openness are important traits in trustworthy professionals. Vague or unclear explanations. If the explanations given for your baby's condition or treatment are vague or unclear, don't hesitate to ask for more details or seek a second opinion. Clear communication is vital for understanding and trust. Now that we know the dangers, how can you protect your baby from harm? It's crucial to be proactive and vigilant in ensuring your baby's safety and well-being. First and foremost, trust your instincts. As a parent, you have a unique bond with your child and can often sense when something is wrong. Your intuition is a powerful tool in safeguarding your baby. If something doesn't feel right, speak up. Don't hesitate to voice your concerns, no matter how small they may seem. Your vigilance can make a significant difference in your baby's care. Here are some steps you can take to protect your child and ensure they're getting the care they need. Always ask questions. Inquire about every aspect of your baby's treatment and care plan. Don't be afraid to ask for explanations about treatments, medications, or procedures. Understanding these details can help you make informed decisions. Get a second opinion if necessary. If you feel uncertain about the care your baby is receiving, ask for a second opinion from another healthcare professional. This can provide reassurance and additional perspectives on your baby's health. Stay involved. Be present during your baby's care whenever possible. Your presence can provide comfort to your baby and allows you to observe the care being provided firsthand. This ensures you're able to monitor the situation and stay informed. Being actively involved helps you notice any changes or issues promptly. Report suspicious behavior. If you notice anything suspicious, report it immediately. Prompt reporting can prevent potential harm and ensure that appropriate actions are taken swiftly. Hospitals and clinics have systems in place to handle such reports and investigate allegations. Familiarize yourself with these procedures so you know what to do if the need arises. Educate yourself about your baby's condition and treatment options. Knowledge is power. The more you know, the better equipped you'll be to advocate for your baby's health. Connect with other parents and support groups. Sharing experiences can provide valuable insights and emotional support. You're not alone in this journey, and others can offer guidance and comfort. Keep a journal of your baby's symptoms, treatments, and any concerns. This can help you track progress and communicate effectively with healthcare providers. Detailed records can be crucial in identifying patterns and making informed decisions. Lucy's case ultimately came to light because people noticed something was wrong and took action. It wasn't just a single observation, but a series of concerns raised by multiple staff members. They spoke up despite the potential risks to their careers. Her crimes were uncovered through the diligence of those who didn't ignore the signs and were committed to patient safety above all else. These individuals raised their voices, ensuring that their concerns were heard. Professionals are held to a high standard of care, and it's crucial for the integrity of the healthcare system. It's essential for all of us to demand that standard. Accountability ensures that healthcare providers are constantly monitored, and that any deviations from expected practices are promptly addressed and evaluated, fostering an environment where patient safety is paramount. Only through accountability and a culture of vigilance can we ensure that healthcare settings remain safe, and awareness can we prevent tragedies like this from happening again. It encourages transparency, continuous improvement, and trust in the healthcare system, ultimately leading to better patient outcomes and a safer environment for everyone. In this chapter, we will explore the psychological profile of Lucy Letby, delving into her background, upbringing, and any potential warning signs that were missed. Understanding her psychological makeup is essential to grasp the complexities of her actions and the factors that may have influenced her behavior. Lucy Letby was known to friends and colleagues as a dedicated and caring nurse. She was often described as compassionate and attentive, always willing to go the extra mile for her patients. However, beneath this facade, there were underlying issues that went unnoticed. Her outward demeanor masked a deep-seated struggle with self-worth and emotional stability. Lucy grew up in a seemingly normal household, with loving parents and a stable environment. Her childhood appeared idyllic to outsiders, but there were subtle signs of her internal struggles. There were subtle hints of her struggle with mental health, such as her tendency to withdraw from social interactions and her frequent bouts of sadness. She often felt isolated and had difficulty forming deep emotional connections. This sense of isolation was exacerbated by her demanding job and the high expectations placed upon her. These feelings of isolation and inadequacy may have contributed to her actions later in life. The pressure to appear competent and caring at all times took a significant toll on her mental health. It's crucial to recognize that healthcare professionals are not immune to mental health challenges. The high-stress environment and emotional demands of the job can exacerbate existing issues or create new ones. The pressures and emotional toll of the job can exacerbate existing issues or create new ones. The constant need to perform at a high level can lead to burnout and mental exhaustion. Lucy Letby's case highlights the importance of providing robust mental health support for those in the medical field. Regular psychological evaluations, accessible counseling services, and peer support groups can help mitigate these challenges. A supportive work environment can make a significant difference. Encouraging open communication and providing resources for mental health can help healthcare workers feel valued and understood. By understanding the psychological factors that contributed to Lucy's actions, we can better prevent similar tragedies in the future. Early intervention and continuous support are key to addressing these issues. We can better prevent similar tragedies in the future by implementing comprehensive training programs that focus on mental health awareness and resilience. It's not just about accountability, but also about compassion and support for those who dedicate their lives to caring for others. Creating a culture of empathy and understanding can help prevent burnout and mental health crises. Let's ensure we create a system where healthcare workers feel safe to seek help without fear of stigma or repercussions. Encouraging a culture of openness can lead to better mental health outcomes for all. Only then can we truly protect both the caregivers and those they care for. A collaborative approach to mental health can foster a more supportive and effective healthcare environment. From a young age, Lucy exhibited signs of introversion and a preference for solitary activities. These early behaviors were often overlooked as mere personality traits. During her teenage years, she kept a journal where she often wrote about feelings of loneliness and inadequacy. These entries provide a window into her inner turmoil and the challenges she faced. Despite excelling academically, Lucy struggled with self-esteem and sought validation through her achievements. Her academic success masked her underlying insecurities. As she entered the nursing profession, these unresolved issues continued to affect her mental well-being. The demands of the job and the need to maintain a professional image added to her stress. The constant pressure to maintain a caring and competent facade took a toll on her psyche. The discrepancy between her outward appearance and inner feelings created a significant emotional burden. Understanding these aspects of Lucy's psychological profile is crucial in addressing the root causes of her actions and preventing future incidents. By providing comprehensive mental health support, we can help healthcare professionals manage their stress and emotional challenges more effectively. In the final chapter, we will provide detailed resources and support for parents who have experienced similar tragedies. This information aims to guide you through the initial shock and the long-term healing process, offering a comprehensive overview of available help. Losing a child is an unimaginable pain, and the path to healing can be long and arduous. It's a journey that requires immense strength and support from those around you, including family, friends, and professional counselors. It's important to remember that you are not alone, and there are numerous organizations and support groups dedicated to helping parents navigate this difficult journey. These groups offer a sense of community and understanding that can be crucial during such a challenging time. First and foremost, consider reaching out to local grief counseling services or national organizations like the Compassionate Friends, which specialize in providing emotional support and practical advice for bereaved parents. These organizations offer support groups for bereaved parents, where you can share your experiences and find solace in the company of others who understand your pain. These communities can provide a safe space to share your feelings and connect with others who understand your pain. They often host regular meetings, workshops, and events designed to help you process your grief and find a path forward. Additionally, many hospitals have specialized support programs for families affected by neonatal and infant loss. These programs are tailored to address the unique challenges faced by parents who have lost a child at such a young age. These programs often include counseling services, memorial events, and resources to help you cope with your grief. Memorial events can provide a meaningful way to honor your child's memory and find comfort in shared experiences. Don't hesitate to ask your healthcare provider about what support is available to you. They can guide you to the right resources and ensure you receive the help you need during this difficult time. For those seeking more immediate assistance, helplines such as the National Bereavement Resource Guide can connect you with professionals who can offer guidance and support. These helplines are often available 24/7, providing a lifeline when you need it most. These professionals are trained to handle crisis situations and can offer immediate emotional support, practical advice, and referrals to local services. Online forums and social media groups can also be valuable resources, providing a platform to share your story and find comfort in the experiences of others. These platforms allow you to connect with a global community of parents who have faced similar losses. On a broader scale, hospitals and healthcare systems must take proactive steps to improve safety protocols and prevent future incidents. This includes reviewing and updating existing policies to ensure the highest standards of care. This includes implementing rigorous background checks to ensure that all staff members are qualified and trustworthy. Background checks are a critical first step in maintaining a safe environment for patients and their families. Providing ongoing training for staff is equally important. Regular training sessions can keep healthcare professionals updated on the latest safety protocols and best practices. Establishing clear reporting mechanisms for suspicious behavior is essential. These mechanisms should be easy to use and accessible to all staff members, ensuring that any concerns are promptly addressed. By fostering a culture of transparency and accountability, healthcare institutions can better protect both patients and their families. Open communication and a commitment to ethical practices are key to building trust within the community. Remember, healing takes time, and it's okay to seek help along the way. There is no right or wrong way to grieve, and finding the support that works for you is crucial. By coming together as a community, we can support one another and create a network of care and compassion. Community support can make a significant difference in the healing process and work towards a safer and more compassionate healthcare system for all. Gap 3S. This collective effort can lead to meaningful changes that benefit everyone involved. Many hospitals also have resource centers where you can find pamphlets, brochures, and other materials that provide information on coping strategies and available support services. These resources can be a valuable starting point for finding the help you need. Social workers in hospitals can be invaluable, offering personalized support and connecting you with community resources tailored to your needs. They can help you navigate the complex web of services available and ensure you receive comprehensive care. Educational workshops and seminars hosted by hospitals can also provide insights into managing grief and understanding the emotional journey ahead. These sessions often feature experts in the field who can offer practical advice and emotional support. Peer support programs, where you can connect with other parents who have faced similar losses, can be particularly comforting and empowering. These programs foster a sense of solidarity and shared understanding, helping you feel less isolated in your grief. The loss of a child is something no parent should ever endure, and the pain is unimaginable. It leaves a void that can never be filled, affecting families for generations. No one should have to fear for their baby's safety while in the care of medical professionals. Hospitals should be sanctuaries of healing and trust, where the well-being of the most vulnerable is the top priority. Throughout this video, we've explored the tragic case of Lucy Letby, a nurse who betrayed the trust placed in her. This case has highlighted the critical need for accountability and transparency within healthcare systems. We've discussed the importance of vigilance, the need for thorough background checks, and the role of healthcare institutions in ensuring safety. It's essential that these measures are rigorously implemented to prevent such tragedies. If you suspect something is wrong, or if you need advice on how to ensure your baby's safety, don't hesitate to reach out to trusted sources. Early intervention can make a significant difference. Don't hesitate to reach out to trusted sources. Whether it's a healthcare professional, a support group, or a helpline, there are resources available to help you navigate these challenging times. Always prioritize your child's well-being. Educate yourself about the signs of potential issues and stay proactive in your child's care. Stay informed, stay alert, and stay safe. Together, we can create a safer environment for our children. By working collectively, we can ensure that our healthcare systems are places of trust and security.